Hi, my name is Terrence Keaney. I'm an associate dermatologist at the Washington Institute of Dermatologic Laser Surgery in Washington, D.C., where I helped co-found W for Men, which is the nation's first cosmetic and laser center dedicated to male patients. I had the opportunity at this year's ASDS annual meeting here in beautiful San Diego, where I'm now in the press room. But I had the opportunity to moderate and lecture in the Menaissance forum, which was a panel discussing male cosmetic procedures. I did two lectures, one on male anatomy and one on the male aesthetic market. So whenever you're considering doing a cosmetic procedure in a male patient, you really need to understand the male anatomy and how it differs from female anatomy. Because traditional studies on cosmetic procedures and the aging face invariably focus on the female face, but the male face has different anatomical features that lead to a different aging process. Number one, if you look at the skeletal features of a male face, the male skull is not only larger but has a different shape. The supraorbital ridge above the eye is more prominent. The male cheek is flatter but wider, and the male jaw is wider and has more forward projection at the chin. When you look at the subcutaneous fat, which is often what we consider when we're talking about volume loss and mid-face volume correction, the subcutaneous fat in men overall is less than in women, and that distribution is different in that the men have less subcutaneous fat in the anterior medial cheek, so their medial cheek to lateral cheek ratio approaches more to 1:1 as opposed to women where it's 1.5 to 1. Once again, this just reaffirms in terms of facial shape and contour, the men tend to be flatter and wider and more square-shaped, and that's kind of normal, whereas women tend to be what we call heart-shaped, where they have a thinner jaw and chin, more of an anterior cheek projection. These are all things to realize when you're trying to correct volume loss. So you got to try to recreate that normal facial anatomy in men, and that is something that's extremely important to consider. Now, the skin is what we call a sex steroid responsive organ, so it also shows gender differences. The male skin is thicker, and male behavior is different in terms of how the skin ages. Men are more likely to smoke, and men are more likely to adopt poor sun protective behaviors. So men are more likely to get sunburns, are less likely to wear sunscreen. Both those factors, including increased UV sun exposure and smoking, leads to accelerated cutaneous aging. So men are more likely to develop wrinkles at an earlier age, and overall men tend to age more poorly in that studies have shown that men often look older than their stated age as compared to women. So all these factors are important to realize when considering cosmetic procedures in your male patients. But cosmetic procedures can do extremely well in men, so it's something to not ignore. Really men are typically uneducated about the cosmetic procedure options that are out there. Media and industry have focused their advertising and education efforts to consumers, to the female consumers as opposed to men. So as physicians, it's important for us to educate our male patients about the available minimally invasive cosmetic procedures, because I find men are really an untapped market. According to the ASDS survey data, approximately 10% of all injectable procedures, that includes botulinum toxin and dermal fillers, are performed in men. Yet survey studies have shown that approximately 40% of men are interested in cosmetic procedures. So that disconnect between interest and actual procedures, I think, is a disconnect due to education and understanding from the male consumer population. So it's important for us as physicians to educate men and not forget about your male cosmetic patient. Once again, I'd like to thank the ASDS for allowing me to speak, and we hope you had a wonderful time in San Diego.